Welcome to OC Live. We're thrilled that you are with us. We're going to talk for a few minutes about our COVID protocols as we enter into this fall semester 2021. Dr. Jeff McCormack and I are sitting in the beautiful McIntosh Conservatory at the Garvey Center here on the Oklahoma Christian campus. A couple minutes ago, we were over in the brand new award-winning Branch cafeteria, but there is a big camp going on right now with lots of students and a lot of activity, so we thought, for our own sake and peace of mind, we probably ought to come over here and talk. I want to introduce Dr. Jeff McCormack. You know him. You've heard him before. Dr. McCormack is serving as our Chief Academic Officer, but he also, for the last year, has been serving as the chair of the task force or the Readiness COVID team. And he's done a great job. He has a great background in that, an epidemiologist and a lot of time in the sciences. And so we are really blessed that Dr. McCormack is a part of our team. So Jeff, welcome back to an OC Live. We've not done one of these for quite a while.
It has been a while. I've missed this. We should do it more often.
Well, I know. And, we did several last summer and some during the school year as well. Okay, so here we are. It's July the 8th, 2021. How'd we do last year?
Last year was truly amazing for so many institutions, and Oklahoma Christian really did a fantastic job. We had great compliance from our students, from faculty and staff. Whenever we talked about the COVID readiness and rolled out the roadmap, students, faculty, and staff, and their parents, they wanted to be on campus, and we were on campus, and it really went exceptionally well. I regularly talk about last year COVID by the numbers, and one of the numbers that I talk about regularly is 0. And the 0 I'm referring to is we had 0 student events canceled last year. We kept doing our activities. We did them different. We were outside, we wore masks, we were distanced, but we kept doing our activities, and that was because everyone was really wanting to be on campus and were willing to take the steps necessary.
So Jeff, let me echo that, because I heard from a lot of folks off campus. In fact, families that had kids sometimes at other universities, and they were amazed at how things were pretty normal here at OC in a pretty remarkable way. Now, what about this next year that's coming up? We start early. In fact, classes begin 4 weeks from today. Now, the great news, students and families, is that the semester is over, finals are done, graduation has occurred before Thanksgiving this fall. So you're going to have a good long break before we come back in early January. But let's pivot and talk about what the semester is going to look like here in terms of how we're going to deal with COVID. So tell us, Dr. McCormack, initially, kind of what's happening in the COVID world.
We learned so much last year about how to manage COVID and how to respond appropriately. And so we learned about how to be flexible and nimble and to pivot, a word we use pretty regularly now. And so we learned so much last year that we know how to respond to specific situations going into this next fall. We have changed pretty significantly what practices are going to be in place on our campus. We know that there's going to be some people who show up that have different situations that they need to be especially attentive to continuing to wear a mask, for example. But we're going to be doing everything differently. It's going to be normal, different from last year. It's going to be very normal this year. But some changes as well.
Okay, so our theme last year was Love Your Neighbor, and frankly, that's our theme again this year. We want to make sure that people are taking care of each other, taking care of themselves as well. Let's dive into a couple of details, though. So first, let me ask you about masks. Last year, our rule was we wanted people in masks. That was really important. There was a lot of discussion in the news media and throughout our country, much less our state, talking about how to be really careful in the time. Masking was an important thing. What's our policy on masks this year?
So this year, our mask policy is going to be masks optional under the theme, Love Your Neighbor. That means for some individuals, masks optional means that they're going to need to continue to wear a mask. But that's not our required policy. Most individuals on this campus will not be wearing a mask, but there may be situations that's important for health concerns. Specific individuals may have some health issues that is going to require them, even if they're fully vaccinated, to continue to wear a mask, but always under the theme, love your neighbor. If someone's wearing a mask, you model that theme, love your neighbor.
Okay, that's a really great point. My guess is that the vast majority of people on campus this next year will not be in masks.
That's correct.
But for people who choose to wear masks, how will the rest of us treat those individuals?
Yeah, so we need to respect that decision, much like we respected decisions in the past about whether they were going to comply with certain of our criteria that we had in place. We respected that. We may have challenged them at different times, but we respect that and we hold to that theme of loving your neighbor.
You know, we had a group on campus this morning, a number of folks that have been associated with the university for a long time. We had them up in the brew. It was a really great conversation, just giving them an update on things. One of the individuals was wearing a mask, and I talked to the person about it afterwards. And the good news is she was really honored for wearing a mask. She was the person in this group that was wearing a mask. Well, she had good reasons to wear a mask, and it was really great how everybody really honored and appreciated her. And I think that's really going to be the theme this year. Okay, so let me ask you about the next specific issue with regard to COVID and the pandemic. What about vaccinations?
We have had amazing partners as we kind of weathered the storm last year, and as we worked through all the different situations and the challenges that came our way. We had a number of partners that joined us on campus to help. One of those was a group called Total Wellness that helped with vaccinations. We're going to offer a vaccination clinic on our campus one day for early on in the semester, mainly for international students that haven't had access to the immunization like so many of us have had. Our goal is to achieve 80% vaccination rate on our campus. We know that our faculty and staff are above 80% already. We've got that data. We don't have the exact numbers yet, but we know that we're above 80% for our faculty and staff, and we really are encouraging students. It's not too late to get your vaccine. So we really want you to be getting your vaccination.
Okay, so I've gotten both of my doses. I've been vaccinated. I was sore the next day in both cases. Are there any big issues related to that?
Well, my wife says that soreness is a sign of wimpiness because I was really sore.
That's what my wife says also.
She wasn't,
yeah.
But
right.
The reality is that means it's working. Your immune system is responding to the vaccine and it's working. And so the soreness, maybe fever, fatigue, that's very normal for a lot of people, but that means your immune system is working really well.
Okay, so the only downside is I actually feel those things all the time anyway, so maybe it's not related to the vaccine. Okay, so what I'm hearing is we're encouraging everybody to be vaccinated, but we're not requiring everybody to be vaccinated.
That's right. We're going to, as you sign up on your on the portal, on the OC portal, there'll be information for the students to log in, the information on their vaccine status. And so we're not requiring it, we're encouraging it, and we've got some really great incentives for those individuals that get their vaccine. Now, I think mine's a little bit...
I don't even know what this is, but it's nice.
It's an Xbox.
Nice box.
You got an Xbox.
Now, wait a minute.
This is, I think, the more expensive one over here.
Well, of course.
It's 1 terabyte of something.
So, now wait a minute.
There you go.
We're not giving these to everybody who gets a vaccination.
No, we're not giving them to everyone who gets a vaccination,
Okay.
but everyone will be entered who gets the vaccination, who has the vaccination. You'll be entered to receive be involved in a drawing for these Xboxes, and also $1,000 off room and board. I think the U Dining is throwing in a full fall semester of dining. So we got some really great incentives. In the bookstore, for those students that are going to be needing books, we've got gift certificates to the bookstore. So some really good incentives. So get your vaccine.
So faculty and staff are qualified for this?
I hadn't thought about that. I don't think so, though. Students only.
If there are any faculty and staff watching this, I lobbied for you guys.
Yeah,
Okay, that is really great. I love that approach. We really encourage the vaccination. By the way, so talk a bit about the vaccine as well. There are some people who have gotten the vaccine and they have gotten COVID, or talk about the variants for a second.
So there are what's referred to as breakthrough cases, individuals who are fully vaccinated and they do come down with COVID. What we know is that it's a much milder case of COVID when they have this breakthrough if they've got the immunization. It's much like the flu vaccine. Many people get the flu vaccine every year, and some still get the flu, but it's a milder case of the flu, and in this case, a milder case of COVID. What we also know is 99%, and in some studies, 100% of the individuals that are hospitalized or have severe cases of COVID today are because they did not get the vaccine. It's so important to get the vaccine. There are variants. There are different types of variants, and Dr. deSteiguer, the president, wants me to emphasize that there is a Delta variant out there. What we do know about the Delta variant and the other variants is the testing that we have on campus that we will continue to have available in the fall semester does detect the variants. So we're in good shape to monitor.
Okay, let's talk about the testing for a second. Boy, last spring semester, you were able to acquire and we rolled out free rapid testing, and it really was a game changer. It did so much for us as we were dealing with people who either got COVID or who might have been exposed to COVID. What kind of testing will be available this semester?
So I mentioned the partners that we've had on campus helping with testing, with the vaccination. We are not going to be having those partners on campus for that testing. We're going to be conducting the testing on an as-needed basis on campus whenever it warrants. We're not doing mass testing whenever all the students come on campus because we don't think we need it. But we do have ample supply of the testing kits to continue to provide that rapid testing. It's a 15-minute test. It's very easy to administer, and it's a highly effective, very accurate test. And I want to just take a moment and say thank you to the Oklahoma State Department of Health for providing us with this testing platform, because it was a game changer for us to have that testing on campus.
Jeff, it really was, but I want to thank you because I think it was your relationships with folks there that really made it available for us.
I actually gave them an Xbox is what I did to get it. No, I didn't do that.
Hey, so let me also ask about, I love the number that you shared earlier, that 0 events last year were canceled. So, but some events did look different last year. We had a number of events that were outside. We had our chapel experiences almost exclusively in small group experiences. What will events be looking like this fall?
I think it's going to look very normal. We're going to have chapel experiences like we've had before. We're going to continue to have our other experiences and events much like we've had before. What we found, though, was some things we really like to do different. We like some of the outdoor activities, and so any opportunity that we have to do things outside, we may continue to try to move things outside.
Okay, so chapel will be occurring in Baugh Auditorium several days a week. We'll have other smaller chapels going on. First week follies, freshman fanfare, homecoming will be back in person this next year. That's really exciting. Of course, the branch cafeteria is going to be fully open as it has been. The brew, coffee shop, and classes. What about classroom management?
Classroom management will look very much like it did pre-COVID. We're not having the spacing that we required before. What I will state is the faculty, because we learned so much in the incident, when there are rare cases of COVID, which we think there will be some isolated cases, we know that we can flex and pivot and quickly move to a setting that allows those individuals to continue in their coursework.
So we're going to be wrapping this up pretty quickly, Dr. McCormack, but I want you to walk us through. Let's say there is a student or a faculty member who is on campus this fall and they don't feel well, and so they come in, we provide the free rapid test, and they test positive. What happens? They have COVID.
Yeah, so we know what to do. We've been through this. We had the experience is in our portfolio now, and so we know how to respond. We know how to contact trace. We know how to isolate. We know how to quarantine. We're prepared for those situations to respond in the way that we know will be effective. And so we feel like we can monitor that and track it.
Very good. So if we need to isolate a student,
Absolutely.
What's going to happen there?
So isolation and quarantine, we have the facilities on campus to do that, for meals to be delivered, much like we did last year. We'll look, in some cases, it's better, it's easier for the individual to isolate, to move back home if they live locally. So we'll look at that as an option as well, but we're going to take care of our students.
Last year, folks, we learned a lot, but honestly, we really operated well even as we were learning. I want to echo what Dr. McCormack said. The faculty and the staff and the student body here, I mean, everybody was so supportive of the protocols we put in place to make sure that we could have a good year here. And it's going to be even better this year. So we delivered almost 7,000 meals to dorm rooms and apartments last year with students who were in isolation or were being quarantined because of close contact. I like to tell a lot of people that OC is like a 5-star resort with room service. So that could happen this year as well. We think the numbers are going to be dramatically lower. We're really excited about this year. I'm grateful for Dr. McCormack and the folks that you have marshaled together to help navigate us through all of this. And we're really excited that you all are going to be a part of the campus. You're going to love it here at OC. You're going to get a great education. You're going to have some great opportunity to grow closer to God, and you're going to make friends for life. And it's going to be a safe environment where we take care of each other. So God bless you. Have a great next few weeks. We can't wait to see you soon. God bless.
Bye-bye.